Enrique, help me out. Yesterday someone mentioned the FDA. Today, my supervisor is talking about Joint Commission readiness. Last week it was Amy standards. Who actually calls the shots down here? Is there one mega boss of a sterile processing, or are we just talking orders from everyone?
The classic SPD mix-up. It feels like everyone with an acronym has a say in what we do. And honestly, they do. But they don't all have the same type of power. To understand the SPD universe, you have to split the players into three main categories: regulatory agencies, advisory, and standard-setting bodies, and also policy-oriented professional associations.
Okay, wait. Regulatory, advisory, and policy? What's the real difference? Doesn't regulatory just mean they can shut us down?
Pretty much. Think of it like driving a car. Regulatory bodies are the police. They enforce the federal and state laws. Advisory groups are like the driving instructors and engineers who write the safety manuals. And professional associations are like the drivers club. They train us, certify us, and advocate for us.
Got it. Let's start with the police then. The regulatory agencies. Who force us to follow the law?
Regulatory. First up, the FDA, Food and Drug Administration. People think that FDA only deals with food and medicine. But in SPD, the FDA regulates medical devices. They decide if an instrument, washer, or sterilizer is safe to sell. They also regulate chemical sterilants and single-use device reprocessing. If a manufacturer gives us instructions for the use or IFUs, the FDA made sure those IFUs were scientifically validated before reaching us.
So when we preach, follow the IFU, we are essentially following FDA-regulated guidelines.
Exactly. Next up in the Regulatory Hall of Fame is OSHA, Occupational Safety and Health Administration. While the FDA protects the patient, OSHA protects us, the workers. They set rules on personal protective equipment, PPE, chemical exposure limits like ethylene oxide or glutaraldehyde, bloodborne pathogens, and workplace ergonomics.
Right. So OSHA is why we wear face shields, heavy gloves, and fluid-resistant gowns in decontamination.
Bingo! Then you have the EPA, Environmental Protection Agency. They regulate environmental disinfectants and medical waste disposal. And don't forget the State Departments of Health, DOH, and CMS, Center for Medicare and Medical Services. CMS controls the hospital funding. If a hospital doesn't comply with infection control rules, CMS can cut off Medicare, Medicaid reimbursement, which can literally force a hospital to close its doors.
Wait, what about the Joint Commission, TJC? Everyone panics when TJC walks in the building.
Accreditation. TJC, along with groups like DNV, is an accrediting organization. Technically, accreditation is voluntary, but there is a catch. CMS trusts TJC to inspect hospitals in their behalf. This is called deemed status. If TJC uncovers major sterile processing failures, you risk losing your accreditation, which means losing CMS funding. When TJC inspects temperature humidity logs or scope cleaning process, they carry heavy enforcement power.
Okay, so FDA, OSHA, EPA, CMS, and TJC are the law and enforcement. Where do organizations like AMI and CDC fit in?
Advisory and standards. Oh, welcome to the advisory and standard setting domain. These groups don't write federal laws, but they write the evidence-based best practices that regulators use as benchmark standards. The absolute titan here is AMI, Association for the Advancement of Medical Instrumentation. Their document, specifically NC-AMI-ST79, is essentially the Sterile Processing Bible. It covers steam sterilization, storage, attire quality assurance, and everything in between. While AMI isn't a government agency, inspectors from Joint Commission or CMS will cite AMI standards when evaluating your department.
What about the CDC Centers for Disease Control and Prevention?
The CDC provides the scientific guidance on infection control and hand hygiene through its advisory committee. HICPAC, they provide recommendations. But again, regulatory bodies often turn those recommendations into mandatory hospital policies.
What about the certification boards like HSPA and CBSPD? Where do they fit in?
Policy and education. That brings us to professional association and policy advocates. Groups like HSPA, Healthcare Sterile Processing Association, formerly ISHM, and CBSPD, Certification Board of Sterile Processing and Distribution, set the educational and certification standards for technicians. They advocate for the state legislative policies, like requiring all SPD technicians to be certified. They also provide ongoing education, publish training manuals, and elevate the profession. Alongside them are nursing associations like AORN, Association for Perioperative Registered Nurses, and infection control groups like APIC, Association for Professionals in Infection Control and Epidemiology. AORN writes guidelines for perioperative care that heavily influence how we handle surgical instruments and endoscopes.
Let me see if I got this straight. Let's say we are reprocessing a complex orthopedic tray. FDA requires the device manufacturer to validate the IFU. AMI and AORN publish guidelines on how to build clean room, run steam sterilizers, and inspect instruments. OSHA ensures I have a safe working environment with proper PPE while handling chemicals. HSP and CBSPD train and certify me so I actually know how to do the job properly. The Joint Commission and CMS walk into the department to verify we are doing all of this correctly and hit us with penalties if we aren't.
Boom, you nailed it. Every single agency, association, and policy group has a distinctive role. They form a protective web around patient care. Without them, there is no consistency. And in sterile processing, consistency is what keeps patients safe from surgical site infections.
Honestly, knowing why they all exist makes following all these strict rules make a lot more sense. Time to go check those temperature and humidity logs. This is a quick reference SPD governance metrics. I'm going to mention first the entity name, then the category. At the end, I'm going to mention primary function in SPD. The first one is FDA, Food and Drug Administration. This is regulatory. Regulates medical devices, single-use reprocessing, and validate IFUs. OSHA, Occupational Safety. Regulatory, protects staff safety, PPE, chemical exposures, safety standards. CMS, Medicare and Medicaid. Regulatory, controls hospital funding tie-ins, mandates infection prevention. EPA, Environmental Protection. Regulatory, the Joint Commission and DND. Accreditation, inspects hospitals and behalf of CMS to ensure compliance with the standards. AMI, ANSI-AMI-ST79. Advisory standards. Establish technical and scientific benchmark standards for sterilization. CDC and HICPAC. Advisory. Issues evidence-based infection prevention guidelines and recommendations. AORN. Policy standards. Provides surgical guidelines affecting point of use, care, and reprocessing. HSPA and CBSPD. Policy education. Provides certification, technician education, and state legislative advocacy. APIC. Policy advisory. aligns SPD operations with hospital-wide infection control measures.
Now for you, I leave this information so you can take advantage of it. I am Enrique Perez, professional certified sterile processing tech. I see you in my next video.